about the reproductive organ, the female reproductive organ. So we have some recaps here. We have the ectoderm, we have the neural crest, neural tube, and then we have the aorta which comes from the paraxial mesoderm. So we have the intermediate mesoderm, and this is the lateral mesoderm. What I want to show here is actually what happened at 5 weeks. So we have the pinch of the yolk sac. So this become the endoderm here now, and we know that the primordial germ cells will move from the yolk sac with the limbic movements from the yolk sac down to dorsal mesentery and goes to the genital ridge. So basically, genital ridge is just a thickening of the mesoderm here, and there will be a formations of mesonephric ducts and also paramesonephric ducts here. So the primordial germ cells now will occupying the genital ridge, forming the ovary. And since in female we don't have the SRY genes, which is sex determining regions on the Y chromosomes, so there is no MRS or mullerian inhibiting factor or TDF, so the testicular determining factor. So we don't have this. Due to this, we have the mullerian, which will grow, which is a paramesonephric duct, and the Wolffian duct will regress. So I'm sketching up. So the because of the positions, this is the mesonephric ducts that will regress in female, and this is a paramesonephric, which located laterally but eventually will move medially from the mesonephric ducts. And at the same time here we have what we call a gubernaculum. It's basically a ligament that will form later. So at this point, there's a lot of origins. There's a lot of theory about the origins of the gubernaculum, but just leave it there. So when it's regress here, what happened is that this would thin. So it will be something like this. And the paramesonephric ducts will bind with the contralateral side, forming the uterus and the fallopian tubes. So this is the ovary, and the remnant of the mesonephric duct will become the hypophoron and ophoron, and also the Gardner cyst. So we have a Gardner cyst here, Gardner cyst, hypophoron. And what happened to the gubernaculum? It will form the infundibular pelvic ligament and the ovarian ligament and also the round ligament. As we know, the round ligament basically will go along the inguinal ligament and attach to the pubic bone and cause the antiflections of the uterus itself. So this is what happened to the gubernaculum. So together with the round ligament, it goes along in the inguinal ligament with the ilioinguinal ligament. So what I want to show here is that what happened during the embryonic lives. So basically here, this is a coronal view and this is a sagittal view. So we have the ectoderm here, we have the ectoderm, it's pinch up, something like that, and we have the paramesonephric ducts here, mesoderm, and we have the ectoderm. If you look through clearly at this point, there will be a spatial parts that we call a cloacal membrane, and which at this point we call it the proctodium. So basically it's a layer, cloacal membrane, between the endoderm and also the ectoderm. So let's zoom in what actually happened there. So we have here we have the endoderm, and we have the, what we call it as allantoa. Okay, at this point, we only have what we call a urorectal septum. Urorectal septum. This is the endoderm. This is the allantoa. Okay, so here at this point is what we call a cloaca. So what happened is that further differentiations and divisions, it will become a rectum here. It's gonna be a bladder here. Okay, so we have what we call here is rectum. We have the, when it separates, it's become the perineal body. So what we have here is that this is a urorectal septum, which is the POD now. And here we have what we call a urogenital sinus. Urogenital sinus will actually connect with the mullerian tubercle and becoming the urogenital bulb. Sorry, sino-vaginal bulb. Okay, so this is urogenital sinus. Further differentiations. So we're gonna have something like this. This is the rectum. This is the future sino-vaginal bulb, which will connect with the mullerian. And we have a vestibule here, but we have a separations there with the bladder and also the future urachus. So allantoa will become the bladder, and this is the urachus. And this is the vestibule. And the vestibule had this urethra opening and also the vaginal opening. And we have the perineal body. Okay, so this is the rectum. This is the perineal body. And it will be something like this. So here we have the genital tubercle, which is somewhere here. So the genital tubercle will become the clitoris. The genital fold will become the labia minora, and the swelling will become the labia majora. And in male, what happened will be the genital tubercle will become the penis, the fold will become the urethral fold, and the labia, the swelling will become the scrotum. Okay, so that is all what I want to show. But another things, what is actually if there is a cloaca anomaly, there is a patient with a rectal opening inside the vagina, or they have a connections in between the urethra opening and also the vagina opening. So there is an abnormality, what you call a cloacal anomaly. But what I want to highlight here is that after the fusions of the of the mullerian tubes here. So we have few anomalies. In a normal condition, there will be a fusions and also recanalizations at somewhere 22 weeks. Okay, so what happened? If let's say it's failed to fuse, it will become uterine didelphi with 2 cervix but 1 vagina. If it fused but only at the distal part, not the proximal part, we will have a biconate uterus. If one of the tube will regress, then we call it unicornuate uterus. And if let's say we have what we call ovira, what happened is that the hemivagina which will have the obstructed hemivagina with ipsilateral renal agenesis or anomaly. So we have only one side of the tubes with the obstructed hemivagina here and ipsilateral renal agenesis. So we have didelphi, we have the biconate, we have unicornuate, and if we don't have anything, we call it a mullerian agenesis or Mrcog. So Mrcog is a disease where the mullerian tube is regressed or it's underdeveloped, but the external genitalia is present and it's normal. Okay.